In this video, I'm going to highlight some important information about Trypan central landmark while doing phagoemulsification applying the CAPSULaser technology. It is a specific area of enhanced Trypan staining of the anterior capsule, provides a visual guide or reference for accurately centering the capsular rhexis, helping to ensure proper centration and placement of the IOL. It is between 2 and 4 millimeter and it presents while using a special Trypan blue dye 0.4%. It is a microfiltered blue dye. It's named Capsule Blue for about 1 minute, as we can see in this picture, and it presents in more than 94% in patient more than 50 years. As we can see in this case, in this picture, it's not clear. Let's go to see another case. Look here to the central Trypan landmark, the TCL. It is an area coincides with the patient's fixated Purkinje reflex, and it provides a more reliable and independent landmark comparing to the pupil center when patient's fixation is challenging. As we can see here, it's very clear and coincide with the Purkinje image. But let's see another case while the capsular rhexis is concentric with the Trypan central landmark. However, it is asymmetric with the patient fixated Purkinje reflex, as in this case the patient is not fixating into the microscope illumination, maybe because of the patient under local anesthesia and it's not done under topical anesthesia. Let's go to see another case. Here we can see a beautiful around 2 millimeter Trypan central landmark coincide with the Purkinje image or Purkinje reflex. See here, the capsular rhexis is concentric with the Trypan central landmark. However, it is asymmetric with the pupil center, and look to the result, a beautiful 360 degrees of symmetrical overlapping of the capsular rhexis with the edge of the optic of the IOL. However, we can see in this picture our capsular rhexis is asymmetric with the pupil center. Here is another case. We can see the capsular rhexis is asymmetric with the Trypan central landmark, and look at the result. We can see also asymmetric overlapping of the capsular rhexis with the optic of the IOL. As we can see, overlapping is good in the superior part. However, it's not good in the inferior part of the IOL. Here is our case of phagoemulsification with aid of IOL using the CAPSULaser technology. You can see now injecting the capsule blue to stain the anterior capsule, then wait for about 1 minute, then wash out the capsule blue, as you can see, then injecting dispersive OVD in backfill technique. Look at the Trypan central landmark TCL, it's very clear, and look at the concentric of the CAPSULaser circle with the central Trypan landmark. As we can see, the capsular rhexis is concentric with Trypan central landmark. However, it is asymmetric with the pupil center, as it's clear here after implanting the IOL. Look at the beautiful result of 360 symmetrical overlapping of the capsular rhexis with the edge of optic of the IOL, and look at the asymmetric of the capsular rhexis with the pupil center. And thank you for watching.